Okay, hi, my name is Shelby Wages. I'm going to be discussing specimen collection for my check off one videos. So to start off, I'd like to talk about blood glucose testing. So I would enter the patient's room, I would introduce myself, perform proper hand hygiene, and identify my patient using two identifiers and making sure that that matched their wristband or their chart or anything like that. I would also then explain to them why they had been ordered to have this test, also the steps that I'll be doing to perform the test. And so then I would perform proper hand hygiene and put on sterile gloves, and then I would inspect their fingertips and choose a lateral site. And then I would prepare all of my equipment, my blood glucose monitor, lancet, cotton ball, all of that stuff. And then I would clean my client's fingers, and then I would squeeze the tip and collect, so the blood collects at the top where we're going to be lancing. So after cleaning and squeezing like this with my non-dominant hand, I would take the lancet with my dominant hand and press tightly against the fingertips and press the button, releasing the lancet and creating a puncture site. I would then remove the lancet and dispose of it in the appropriate place. I would then clean the fingertip, wiping away that first droplet of blood, and then I would take the monitor with the reading strip in it and place against the fingertips or against the blood droplets, making sure that it had plenty of blood to test. And then I would set that down and give the patient a cotton ball to hold to his or her fingertips. I would then document what that monitor said, and I would then dispose of everything in the appropriate places, and and then I would want to make sure that my patient had stopped bleeding before I disposed of my gloves and performed proper hand hygiene and left the room. Again, making sure I documented everything appropriately. And so next I'm going to talk about clean catch urine sample. And again, for that, I would introduce myself, perform proper hand hygiene, ask for two identifiers, and explain what and why we're performing the test that we're performing. So I would make sure that I had a sterile specimen cup with me, and I'd want to explain to the patient how to clean the perineum area. So for a female, you want to, if the patient can do it, then I would have to do it, but explaining to them how to clean themselves properly. For a female, I would explain to them with their non-dominant hand that they should separate their labia minora, and then using a clean towelette or a swab, whatever the sanitary item should be that we provided for them. They should swab that area front to back at least 3 times using a different towelette or whatever it may be, starting from the labia or the fold furthest from them, and then moving to the one that was closest to them, and then finally the one down the middle, always going front to back. And then after they've done that, they should urinate just a little bit, still separating the labia minora. They should urinate a little bit and then collect 90 to 120 milliliters of urine, and they should take the cup away before they fully finish urinating and before they stop separating their labia minora. And then for a male, we would ask that they, again, using a towelette or whatever we provide them, if they had foreskin, to pull the foreskin back and then swab their meatus at least 3 times, again using a new sanitary wipe or whatever each time, going from inner to outer. And then we would also have them rinse with water. And then again, for male and female, we might have them dry that area if needed before urinating. But for the male, the same thing, they would urinate just a little bit beforehand, and then they would collect 90 to 120 milliliters of urine. And so once they've done that, we would also want to make sure that we explain to them properly not to touch the inside of the container before or after collecting the urine specimen, or the lid. So we would keep a hold of the lid, and then once they brought the specimen out to us, we would clean off the outer side of the container if need be, and again, being very careful not to contaminate the sample, and then screw the lid on tightly and label appropriately. And then we would take that to the lab as soon as possible. Again, making sure that everything was labeled appropriately with the lab requisitions and things like that. And then we would make sure that we documented this properly, and we would discard our gloves and perform proper hand hygiene after cleaning the specimen cup and things like that. So after the clean catch urine sample, we're going to talk about throat cultures. And for a throat culture, after your introduction and identifications and hand hygiene, you would explain to the patient what tests you'll be doing and why. And so I would need a cotton swab, a sterile cotton swab, and a tongue blade depressor, and a sterile tube for the lab. And so after preparing everything, and after explaining it to my patient, I would ask that they open their mouth and say "ah," and then using a tongue blade depressor, I would depress their tongue, being very careful not to cause any discomfort or hitting their gag reflex. And so using a sterile cotton swab, I would put it in the tonsil area, being very careful not to touch the lips, the tongue, the cheek, or the teeth. And I would swab that around 3 to 5 times each side, and then I would put the cotton swab into the tubing, and I would make sure that that was labeled appropriately, asking my client again to identify themselves if needed, and then I would take off my gloves, perform proper hand hygiene, and make sure that that got to the lab as soon as possible. And again, making sure that it was labeled appropriately and documented accordingly. And then for our sputum cultures, go in, identify ourselves, practice proper hand hygiene, have our patient identify themselves, explain what tests we'll be performing and why, and we would need a sputum cup. And so we would ask them if they needed to rinse their mouth out first. We want to make sure that they don't do this with any mouthwash or anything like that, just only water beforehand. And so we would ask that they take 3 to 4 deep breaths, and then on the last one, cough, trying to get that sputum up, and if they got the sputum up, then they could spit that into the sputum cup, and then we would make sure that the lid was closed and it was labeled appropriately. Then we would perform proper hand hygiene, take off our gloves, perform proper hand hygiene, make sure that got to the lab, and make sure it was labeled accordingly. And next we have our wound culture. So for our wound culture, we would do our introductions and identifiers and practice proper hand hygiene, and we would explain to the patient why we're there, why we're performing that test, and we would prepare and make sure that we had everything we needed, and we would explain how we're going to be doing that, and we want to make sure our patient stays comfortable. So we would adjust the bed to an appropriate height level, and we would undress the wound and apply, irrigate it with sterile saline, and then we would take our sterile cotton swab and swab the wound, being careful not to swab the edges. If the wound was large, we might need to do this with multiple sterile swabs, and then we would place the swab in the tubing, the correct tube, and we would crush the bottom where the medium is, releasing the medium, and then pushing the cotton swab back down into the tube so it was in that medium the way it was supposed to be. And then we would redress the wound as needed, and make sure that those tubes or the tube is labeled appropriately, and make sure that we document that appropriately and get it to the lab and as quick as possible. Again, making sure that we take off our gloves and perform proper hand hygiene. And so next we have our hemocolt test, and for our hemocolt test we would have a stool sample, and for this we either we collect it or the patient would collect it, and we want to make sure that we get at least 3 centimeters, and then if it's liquid, 15 to 30 milliliters, and be aware that some of these require a chemical preservative or ice, to be on ice or refrigerated. So once we have that, we would take our sample, and we would take a tongue depressor blade and take, after we've opened the hemocolt paneling test, opened the flap, we would take our tongue depressor and take a small amount of stool and spread a thin layer onto panel 1, and then we'd want to discard of that appropriately, and then grab another tongue blade depressor and get another sample from a different area of the stool, and then spread a thin layer onto the second panel, and then we would close the flap and turn it around, and there on the back panel we would put 2 drops of developer on panel 1, and then 2 drops on panel 2, and then we would also put 2 drops onto the control panel of that test, and then we would wait. It takes 30 to 60 seconds for the results, and if it was blue, that would indicate a positive result, indicating that there was blood in the stool. If there was no change, then that's a negative result, indicating that there is no blood. And then again, we want to make sure that we discard of everything appropriately, take off our gloves, perform proper hand hygiene, and then document all of our findings. So that's it. Again, we want to make sure that we document everything appropriately and perform our infection control appropriately.